Hey guys, we're back. Oh, surprise, sorry. So we're doing a Wednesday lesson of the day. This one is going to be about my sty in my eye. Sty eye. No, it's not going to be about that. So the question today I got overwhelmingly was, do I have to perform a brow lift with a facelift? And it is because these patients didn't really come in for a brow lift. Ooh, Tara Strong, my friend, hi. So, about this guy, this is a sty, also known as a hordeolum, and I've never had one in my life, and just got one recently because Dr. Ritu Chopra, kept playing with my eyeball, so this just happened. So, finally it's going away and it's calming down, but I gotta wear glasses, can't wear my contacts, and either way, back to this. So what we saw today over and over again was patients asking, do I need to get a brow lift? So I had a lot of consults today, probably about like 45 or so, and the question was because the patients felt like their brow looked fine, they were getting a face and neck lift, and their concern was that brow lifts make them look fake. So I'll go over this and then why you gotta do a brow lift with a facelift sometimes. So the brow lift, what it does in general, if you do an endoscopic style brow lift, is you make incisions back over here. Some people do 4 incisions, some people do 5. I do 2. I do a hybrid, 1 here and 1 here. The whole idea is that you take the brow back to where it came from. So it's not an unnatural thing to do. It's a restorative brow lifting technique or procedure. So it doesn't look fake. So that's number 1. And people say, no, but I see them and they look fake. I go, did you see it on my website or did you see it elsewhere? And they said, no, I saw it elsewhere. I say, well, it's because they do it differently. Don't worry about it. We just make it look natural. So when you do a brow lift, you end up lifting the weight of the brow back to where it used to be. Now, some people drooped on the side. Some people drooped in the middle. Some people peaked with age over here because everything was coming down and they started to compensate. And this is the strongest part of your frontalis, if you see that right over here. That's your conjoint tendon. This is the diastasis where the muscle spreads, and then there's the middle of the muscle where it's the strongest. So you can see that's the strongest part. That's why this part of the eyebrow peaks over time. So a patient who had a peaked eyebrow said, no, I already have high eyebrows. I don't want to make it any higher. And I explained to him, no, your eyebrow is high because you're compensating for your ptosis and your droopy brow, so your brow ptosis. So that's why we need to do it on you. But the reason I wanted her to do it, and this is the whole relation between facelifts and brow lifts, is that when you do a big facelift and somebody has hyper lax skin, not like me. So if I do it, I have like a little bit of laxity and I don't get much bunching here. But there's some people where you do, my style looks funnier. So you do a facelift and they have hyperelastosis and this just bunches up like crazy. So it gets to a stopping point. And the reason that happens there is because this is the stopping point of our surgery, and there's a natural disjunction point where the zygomatic arches and the SMAS from here, which is temporoparietal fascia, becomes facial SMAS. And you can't really connect those planes so easily above the periosteum without causing nerve damage. So either way, this is a facelift, and if it bunches here, that's the reason why some people have to do a brow lift. And realistically, the patients I saw today all needed just a temporal brow lift. So lateral or a temporal brow lift. And Dr. Chopra says I need a weekend lift. That is correct. I do need that. So what do we do? If you do a facelift and they don't want to do a brow lift, but they're bunching here, you just have to extend your incision. Extending the incision, it really just goes as tall as the brow, usually not over that. But it does extend the incision, and I like to avoid that if possible. I like a really short incision there. The brow lift, if I do it endoscopically, is through a separate incision here. It's hidden, and it brings the tail of the brow up. Face goes up with it. Now you have one unified unit. If you see, everything goes up together. The other reason for doing a brow lift with a facelift is if you're doing an endoscopic type mid-facelift. And if you're doing an endoscopic type mid-facelift, whether it's the endoscopic type deep plane lift that Dr. Ko does, or an endoscopic subperiosteal facelift, you will have more success with that if the brow goes up with it, because your access points are up here and you want as little weight as possible on the rest of the facelift. So those are the reasons why you do the brow lift with a facelift at the same time. Now, I also had 3 patients or 4 patients, hi Esther, asked me for a brow lift today who didn't need it, and I advised them what I had said before in other seminars or lectures or things that I do. I say a lot of young people come in doing a brow lift and they get one improvement, which is they get that arc that they like, but then they get 3 negatives, which is they get hollowing, they get more eyelid exposure, they look older, and they look more tired. So all those things happen because of that. They look like startled, but then they look hollower here, darker. It makes them look a little more aged. It doesn't look great. So those are the reasons not to do a brow lift. If you already have enough space here, I had another patient who needed a brow lift, but her space here being full looked good. So if you do a brow lift and you do an upper eyelid surgery, you end up hollowing that area. So I had to tell her, I'm going to leave some extra skin on you here, leave some fullness, because it's not going to look good on you if you have a taller eyelid space. You see, this is a short tarsal show. That's more a tarsal show. This is your tarsus right here, that cartilage. So on her, she looks good just where everything is like nicely covered. She doesn't look good with a lot of tarsal show. So I advised her, I can do a brow lift. It'll make you look better, but I'm going to fix your ptosis so your eye opens up more, decreases your tarsal show, put a fat graft there to bring the eyelid down a little bit, and then clean up just a little bit of skin, leaving some excess. So those are the things that you play with, or things that you worry about with that. So that's it for the main question I got today. Nothing too exciting today. The other thing I got today several times is, what's the difference between the way you do a lip lift and everybody else does a lip lift? And I try to explain to them, well, I'm the difference. I'm just really good at it. So that's not sufficient for most people. So then I advised that no, there is a specific thing that I do called a Cupid lift, where you can actually redesign the lip lift. And if you see here, this is an example of a Cupid lift. So here you can see the lateral parts of the lip are completely buried over here. The central part is peaked, and then here you see it's a more even exposure all the way across. And this is the magic of a Cupid lift, is that you can do that. Now, if you've done 1,000 lip lifts and you're that doctor, you look at this and you're like, damn, that's kind of cool. If you've only done 2, or you're a patient, you're like, okay, I'm not that impressed. But it is impressive. I'm impressed myself sometimes with the results of these things, because it's very cool how it comes out. Here's another one, and here's what we're talking about. So, patient who's centrally peaked, if you do a lip lift on her, you're going to get only this part going up, and you can see her, she actually got more exposure along the lateral. So this is a laterally biased lip lift, where I took more from the side than the middle. I took more from the trough than the peak. You can see it's flatter across now. And then I got more exposed on the sides with corner lift. So this is a Cupid lift. Cupid is central line, peak, intermediate, diagonal. Those are the lines that you use to design this. So that's really the cool thing about the Cupid lift, is that you can, with extreme precision, get things lifted to get nice balance, not just kind of lift up the middle portion there. That's that. So that's a Cupid lift. Cupid lift is the design for the deep plane lip lift. Deep plane lip lift is the kind of lip lift that I do, which just means I'm releasing the SMAS off the muscle and lifting it. And the Cupid lift is how I draw the design. So the Cupid lip lift is very helpful, I think, to like doctors who are trying to learn this stuff. And I teach the technique. They're more they can definitely use the technique. They just can't use the name because it's trademarked. So that's the Cupid lift, is a fancy name. It's just a acronym, really. CPID, central, peak, intermediate, diagonal. And the lip center we are opening will be featuring the Cupid lift, and we're going to go different areas around the country soon. So we'll be revealing that. But that's going to be our new lip center, and it has other stuff that are kind of cool. So that is all. Nothing too different today. Otherwise, I hope everybody has a wonderful Wednesday, and thankfully we're getting out of here at 7 p.m. Chopper can use it, nobody else can. All right, have a good night.